All right, go ahead.
Okay, what is a vertically integrated healthcare network by Nicole Aquino, Sydney Fitzpatrick, and Emily Tollefson? What is a multi-hospital system? A multi-hospital system is two or more hospitals owned, leased, sponsored, or contract managed by a central organization. All vertically integrated healthcare networks are multi-hospital systems, but not all multi-hospital systems are vertically integrated healthcare systems. The difference being that um, vertically integrated healthcare networks they own their own captive health insurance company, and and that's the difference. And one example is the Johns Hopkins Health System, which is a $7 billion vertically integrated system. They have several highly rated hospitals and many affiliated primary care practices across the state, and they also own a large population-based health plan with over 350,000 enrollees. Another example is Intermountain Healthcare in Salt Lake City, which is a nonprofit. It is the largest healthcare provider in the Intermountain West with more than 35,000 employees, 22 hospitals, 185 clinics, and 1,400 multi-specialty physicians serving communities across Utah and southeastern Idaho. And they also have their own health insurance plan, which is Select Health. Hospital Corporation of America is an example of a multi-hospital system that is not vertically integrated. They consist of locally managed facilities that include over 250 hospitals across the United States and in the UK, but because they do not own their captive health insurance plan, they do not qualify as a vertically integrated healthcare system.
Okay. So what is a vertically integrated healthcare network? In vertically integrated healthcare networks, the system has an ownership of facilities and physicians and health insurance under a single corporate structure. In vertically integrated healthcare networks, each of these systems has physicians or are employed or on a contract to the system, owns and or manages provider organizations, or owns one or more captive health insurance companies. Um, in vertically integrated healthcare networks, the organization or a healthcare system incorporates a complete spectrum of care, including financial services, is provided with a single organization, such as a health maintenance organization. Vertically integrated healthcare networks are often and unique from many other networks because of the sharing of information among team members related to patient care and the establishment of comprehensive treatment plan to address the biological, physiological, and social needs of the patient. Integrated healthcare is also known as interprofessional healthcare because of the high degree of collaboration and communication within the health professionals in the network. Integrated healthcare ensures that patients are receiving complete treatment as well as care and their overall well is being improved. Most have found that integrated healthcare networks are extremely beneficial, and in integrated systems, they found that there is success in notably physician-driven systems, unified clinical and administrative cultures, a long history with sufficient time to develop this culture, and strong economic interdependence among the three arms, physicians, the hospital, and the health plan.
Okay, so I was in charge of getting examples, and along with Emily's examples of like the Intermediate Healthcare, Intermountain Care Center, and the John Hopkins Hospital Corporations of America multi-hospital system, the Carolina Healthcare System is the largest healthcare system in the Southeast. It's the second largest public multi-hospital system in the nation. They have over 38 hospitals, 8 rehab hospital units, 10 nursing homes, and over 600 outpatient service locations, and about 1,900 integrated physicians and over 300 residents in that healthcare system. And the vertically integrated healthcare example that I got was the Kaiser Permanente. It's the most well-known example of vertical integration. It operates in 9 states including Washington, D.C., and almost has 9 million members, 14,000 doctors, and 160,000 employees. The system owns and operates more than 420 freestanding ambulatory care facilities and 30 medical centers. The medical center offers one-stop shopping for most services, including hospital, outpatient offices, pharmacy, radiology, laboratory, surgery, and etc. With being set up like that, it helps patient compliance and gives opportunities for physicians at the primary care level to consult with specialists and hospital personnel. So this was like in the textbook for this week about integrated healthcare networks, and this is just naming the top 25 healthcare networks. I just thought that was interesting to look at all those statistics and see the differences. And this is a video. I won't play it, but if y'all want to watch it, you're more than welcome to. It's about this lady who worked with the Kaiser Permanente right here, and she was just overwhelmed with the experience that she got with using a vertical integrated healthcare system, and so it's kind of just her little testimonial about how she loved it and wouldn't go anywhere else. And that was it.
Awesome, great work. I mean, I like how Emily pointed out that an integrated health network is not necessarily a multi-hospital system. Or sorry, a multi-hospital system isn't an integrated health network, but all integrated health networks are multi-hospital systems because they have that complexity with the health insurance plan. And thank you for bringing stuff in from the book about those top 25. I don't know if that's still the same. That's kind of some old information, but hey, the hospital system, the system that I work for is number 1 on that list, so I think it's pretty cool. So I'm going to ask you three each a question, same question. It's the same question I've asked every student as we've done this. And I'll just work my way across the screen, so I'll start with Emily and then work across, ending with Sydney. So just Emily, what was one of the main or biggest surprises or most the coolest thing that you learned as you were studying about multi-hospital systems and integrated health networks?
Well, one of the questions that guided us for the project was to pay special attention to the role of physicians in the systems, and I couldn't quite find a lot of definitive information on that, but through my readings, I gathered that in the vertically integrated healthcare systems and in multi-hospital systems, the physicians get to spend more time being a physician and taking care of patients versus being involved in running and managing their business. And so I like that aspect of it, that the physicians are able to go to work and take care of patients. Obviously, there will be physicians in the in higher roles as far as administration and things like that, but that's something that they would choose to do to move on to that. But I like the idea that in general, the physicians who are involved in multi-hospital systems and vertically integrated healthcare networks get to take care of patients, because I think that's why they became doctors.
Yeah, great. Thank you. Nicole?
I didn't really know much about like vertically integrated healthcare networks, and like both of my parents are nurses, and I tried asking them for help, and they didn't really know much either. But it was really cool, like researching it and finding out which hospitals are like vertically integrated, because the one they work for at home is also vertically integrated, which they didn't know. And Kaiser is like near my house and stuff like that, and I think that it really shows like how beneficial it is for hospitals, because the hospitals like that I've seen that are vertically integrated are like thriving really well, and they have like really good patient care. So that was something I thought was really cool.
Yeah, Kaiser, another thing that Kaiser is going to be doing is they're opening a medical school. So I don't know what you'd call that, but I mean they're already a vertically integrated network, and they're going to add a medical school to it, which I think is actually a really cool and good idea. Yeah, Kaiser's a big deal. Sydney.
One of the things that like really, I didn't really know much about like vertical integrated healthcare system either. One thing that stood out to me was what Emily kind of said is how the physicians get personal with the patients because it gives more. As a patient, you feel more important that like they're really focusing just on you and not like you're on their checklist to go look at. I also like that it's kind of a one-stop service where you can get all you need kind of in one place. It's a lot easier for the patient, and it's also easy, I think, for the doctors and the patients and specialists all easier to communicate with when they're all in one spot. I think it's a lot helpful for just everyone all around having that one-stop service, kind of an integrated healthcare system.
Great. Well, thank you. I'm going to stop recording, but hang on for just a sec.